worked up about a vaccine passport? Should I be worked up about it?
Well, thankfully, at least some of your data is actually broadly kept confidential. That's your medical record. It is true that there are breaches of medical information, financial information, but the NHS, by and large, does a very good job of looking after your medical record. Yeah. So what we're talking about here with a vaccination or even a test is something that had entered into your GP record. Yeah. It's also held in what's called the System of Record, which is another NHS database. But what are we talking about here? I know there are many arguments and sort of principled arguments, what have you, and I share many of those concerns. But if what we're talking about is logging in your mobile phone to a bit of your medical record and then handing it to a bouncer, a member of bar staff, or if you're travelling internationally, a foreign official at a border, this doesn't seem to me to be sensible or proportional. Medical officials perfectly fine with a piece of paper like we have for international sort of vaccinations. There's something called the yellow card, which is used for yellow fever, and over the years has been used for other diseases as well. But anything more than that, a digital app thing on your phone or what have you, you have to think about the actual practicalities, the security, the safety of handing over a logged-in digital device, if you even have one, to someone who you don't know. And will they be doing the same for you? Because, to be perfectly honest, we're talking about a virus. A virus doesn't care. It doesn't care about apps, doesn't care about certificates, doesn't care about anything, frankly, apart from infecting people. Yeah? So what we really need is, before there's any sort of dramatic possible, is that everyone is at least offered vaccination. Once people have
digital, but for someone like my mother-in-law, that would have to be paper, and that were free. It were provided by the NHS and not some sort of private provider. They're going to make a lot of money out of it, and it was available to everybody, including clearly people who couldn't have the vaccine for healthcare reasons, having a clear exemption that would not exclude them from something, i.e. was completely equal and free as the NHS should be, then that would be okay. But until it can be equally accessible to everybody, I would be very unhappy.
And okay, well, thank you for being so frank with that. And also, Helena, if I could ask you, people talk all the time about blood clots and AstraZeneca. 30 cases of rare blood clot events linked with low platelets out of 18.1 million doses. I did the mathematics on this yesterday. The percentage is I mean, it's minuscule. It's almost an irrelevance, of course, not for those who've got blood clots. But it's being used, isn't it? This as by people who are reticent to take the vaccine or absolutely against it as evidence that the AstraZeneca jab is not safe. Could you give us a view?
I think we have to be very careful here that we don't, either of us, repeat malicious things that could cost lives. So I am very, very keen that if any of my patients or listeners are listening to this, that we take up the offer for vaccination the moment we are offered vaccination, and that we go back and have the second dose if it's a vaccine requiring 2 doses. It is much, much safer to be vaccinated than to get this disease. Is it we just talked about long COVID.
Yeah.
Not only is it a very dangerous virus if you are unlucky, but we know that 1.1 billion people are suffering the effects of COVID a year after COVID. So this could affect you for the rest of your life. It is much better to get vaccinated. Please take up the offer.
Helena McKeown, thank you very much indeed. Chief Officer at the British Medical Association. 7:28 is the time. These vaccine passports, COVID certification, if you will. Beverly's in Maidenhead. Hello, Beverly. Hi there.
Right. Scientifically, the idea of these vaccine passports really doesn't make any sense at all, because there's no vaccine that's 100% effective. So put very simply, if a vaccine is 90% effective, that means that for 10 people in 100, roughly, even though they've been vaccinated, it hasn't worked for them.
No, hold on. Beverly, can I just interject there? Because when you talk about efficacy on a vaccine, everything that we're reading and seeing, and now we've got real world data as well, is suggesting that what efficacy refers to is sometimes confusing. We have got virtually a 100% chance of not becoming seriously ill and therefore not dying when we take a vaccine. That's it's almost 100%.
Right. Well, I've had the vaccine.
Yes.
I waited 3 weeks. I had an antibody test, and I haven't got any antibodies.
Well, I'm not medically qualified, and I wouldn't know what, why, how, or whatever. So I can't really answer your concerns, Beverly, but you are concerned.
Yes, I'm very concerned, and because I used to work developing antibody tests to monitor the effectiveness of vaccination programs. So as far as I'm concerned, if I haven't got any antibodies after waiting 3 weeks when they're supposed to be at their peak, then it hasn't worked for me.
And what does your doctor say?
I got absolutely nowhere with trying to have a conversation with my GP, where I said that I can't see the point of me having a second jab of the same vaccine because it hasn't worked for me with the first jab.
Do you know, I wish I could answer your
I'd like
question.
to wait
Yes.
until one of the others comes on stream, like the Moderna vaccine, and even if I'm going along with the people who are 30 years old to be vaccinated, I would like to have a different vaccine.
You've got to call your GP and say, I need to speak to someone.
home improvements. With a Nutmeg ISA, you get jargon-free expert investment management to help